Hello friends, today I am going to talk about the physiological changes during pregnancy. So pregnancy जब women pregnant होता है उस समय physical many physical as well as biological changes होता है. तो क्या क्या changes रहता है we are going to talk about it. So during pregnancy there is a progressive anatomical and physiological and biochemical changes, not only confined the genital organ but also the system of the body. During the pregnancy there are anatomical as well as physiological, not only anatomical physiological but also the biochemical changes occurs during the pregnancy. So what are the changes here? The first thing is in the genital organ. So in the genital organ the vulva become edematous, थोड़ा swell हो जाता है, and vagina में क्या होता है, hypertrophy हो जाता है, edematous हो जाता है, okay, and थोड़ा सा bluish discoloration हो जाता है, that is called as Jacquemer sign. And in the uterus जो बच्चा को कैरी करता है, in that what happen here is the weight during the non-pregnancy, when जो मदर प्रेग्नेंट नहीं होता है, नॉन प्रेग्नेंट मदर लोग का the normal weight of the uterus is calculated as 60 to 100 gram. Okay, and the length is 7.5 centimeter, and but during the pregnancy it keep growing and it keep lengthening, as well as the capacity of the weight also will keep increase. So during pregnancy state 900 to 1000 gram weight, and with the length of 35 centimeter. Then this keep increasing as the gestational age of the mother grow. And in the breast, so breast में क्या changes होता है? The changes in the breast is the evidence of that the mother is first time pregnancy, because when the mother is first time pregnant, the changes we can identify more better than the mother who are already have a kids. Okay, then in the size of the nipple will increase, and there is formation of a areola, secondary areola. Normally primary areola is present for pre-pregnant mother, but during the pregnancy time the secondary areola will present. So nipple become larger, erectile, and deeply pigmented. Okay, and marked irregular pigmented area appears in a second trimester. Okay, second trimester means after 3 months, when start from 4th month, it's called as secondary areola. So secretion. So what happened here is there is some secretion from the breast to the nipple. So that is during the pregnancy, when there is a secretion, that is called as colostrum. So when does the colostrum start secreting? It starts around from 12 weeks of gestation, when the mother is at the counting from the conception till from 12 weeks. Okay, we call as gestational age. So 12 weeks, which at the first becomes sticky. It is at first it looks like sticky, but the secretion will not so spontaneously. When we squeeze the nipple, it can visible the secretion, and on 16th week it becomes thick and yellowish color. Next is the cutaneous changes. Cutaneous means in the skin. What are the changes we can observe in the pregnant mother? First is pigmentation. So pigmentation, the distribution of pigmentary changes is selective. Some mother might have got pigmentation, some might not get. It depends, but mostly it might develop. Usually where it develops, mostly in the facial area. Okay, in facial area the pigment, the brownish coloration which is developed. The third is called as chlorisma gravidarum. Next one here in the abdomen, if you see the abdomen, you can see a line, a brown line from the sternum till the symphysis pubis, which is visible line, which is called as linea nigra. Next one, in the abdomen, as I said, linea nigra, which is brownish color from symphysis pubis till the symphysis sternum. Then another line you can see, which usually we call as stress marks, which is called as stria gravidarum and stria albicans. Stria gravidarum, when the stress mark newly developed pinkish color, that is called as, and albican, the old stress mark which is the become whitish color, that is called stria albicans. Then mother will gain weight obviously within this pregnancy period. Average 11 kg weight the mother will gain, and body water metabolism also become hypervolemia. There is an active retention of sodium and potassium and water, which maintain for maternal osmoregulation and increase estrogen and progesterone hormone, increase aldosterone because of that. Okay, and next is hematological changes in the blood. What are the changes? The blood volume become increase, and plasma volume also, RBC level requirement become more, hemoglobin requirement become more. Okay, then the leukocyte and immune system also, and neurophilic leukocytosis occurs to the extent of around 8,000 per mm3 and even the 20,000 per mm3 in labor. Okay, then total protein requirement also increase. Total plasma protein increases from normal 180 gram to then to the 230 gram. Means 180 gram is required for non-pregnant mother, but when the mother gets pregnant, then required 230 gram at terms. Blood circulation factor, like pregnancy is a hypercoagulable state. Okay, so fibrinogen level is raised by 50% from 200 to 400 mg per dl in non-pregnant to 300 to 600 mg per dl in pregnancy. And cardiovascular changes occur. In the cardiovascular, what happens? Anatomically, if you see, as the uterus grows higher upward direction, it gives pressure to the lungs of the mother. As it gives pressure, the heart also slight changes in the position, little upward and outward direction. So this gives little discomfort in the breathing to the mother. And even the cardiac output also will start increase from the 5th week of pregnancy, and reaches, it peaks to 40 to 50% at about 30 to 34 weeks. The cardiac output. Blood pressure. About the blood pressure also will slight increase in the blood pressure due to muscle relaxing effect of progesterone, and decrease of systemic vascular resistance, venous pressure. Okay, and during the supine position mostly it increases. Metabolic changes. In metabolic changes are like fat metabolism. Average 3 to 4 kg of fat is stored during pregnancy, but mostly in the abdominal walls, breast, hips and thighs it stores during the pregnancy. Iron metabolism, carbohydrate metabolism, all this. And systemic changes. In the systemic changes, respiratory system. So with the enlargement of the uterus, as I already said, especially in the later month, there is elevation of the diaphragm by 4 cm, slight elevation of 4 cm. So total lung capacity is reduced to 5% due to elevation of the lungs anatomically. Okay, then the urinary system. In the kidney also there is dilatation of ureters. So renal pelvis and the calyces, the kidneys enlarge in length by 1 cm. Okay, and glomerulofiltration rate, which is called as GFR, is increased by 50% all throughout the pregnancy. So ureter become atonic due to high progesterone level. Okay, and bladder, there is marked congestion with hypertrophy of the muscle and elastic tissue of the womb. Alimentary system also slight changes will be there. The gum become congested and spuzzy and may lead to touch, okay, muscle tone and motility of the entire gastrointestinal tract are diminished due to high progesterone level. So all these functions changes, nervous system, endocrine. About the brief explanation about physiological changes during pregnancy. Thank you. Bye bye.